time. I call the member for Pittwater.
Mr Speaker, I rise in support of the Health Services Amendment Northern Beaches Hospital Deed Termination Bill 2025, introduced by the member for Wakehurst. It is time to bring our hospital back into public hands, to ensure we are no longer at the mercy of corporate entities or their receivers, which have failed us, and to avoid drawn-out negotiations that risk patient safety and the health and safety of doctors and nurses also, to prevent taxpayers from funding windfall profits, and to clarify a deed that continues to fail us, even after the operator, Healthscope, has gone into receivership. This bill is a measured and necessary response to a broken deed, and I thank the member for Wakehurst for his leadership, which has occurred over many, many years, for addressing some of the issues that we have seen in our hospital. Without him, we would not have had the independent audit into the hospital that has exposed the failings that have been found by the auditor. I've recently co-hosted a public forum, and of course he has recently introduced this legislation. Together with community and hospital staff, we have now built the case for public control. And I thank also the Minister for Health and Treasurer for their genuine engagement with my community on the issue of the hospital, and the huge amount of work and time that they have dedicated to addressing the failings of the hospital and getting it into public hands. And of course, also want to acknowledge their teams. It is this exorbitant amount of time and necessary dedication to these issues which is in part have caused the member for Wakehurst to bring this bill to Parliament, and now to avoid the long and protracted negotiations that are at risk or even potentially legal battles. Since entering Parliament, I've received numerous emails, attended packed public meetings, and sat with families who have experienced the hospital's tragedies. And of course, I want to acknowledge some of those families today: the Massa family, the Gill family, the Atkinson family. They say the same thing, that the hospital is not delivering the public health care that our community deserves. As we've heard previously, in 2018, the former Liberal government closed public hospitals in our electorates, being the Mona Vale Hospital, Manly Hospital, and replaced them with a single privately operated facility, the Northern Beaches Hospital, run by Healthscope under a 20-year deed. The negotiations lacked transparency and the promises were big, but the results have not been realised. We have fewer public beds, less transparency, and poorer outcomes. The private operator, owned by offshore private equity up until recently, has received tens of millions in additional funding while incurring only a token for penalties and failures. Healthscope is now in receivership. This should arguably trigger the ability of government to step in. It doesn't, and that's why the bill is before us. Or it doesn't, clearly. Public ownership is not perfect, and I think everyone acknowledges that public hospitals aren't perfect, but it is better. The Australian Salaried Medical Officers Federation recently confirmed this in their submission to a current inquiry. They outlined systemic problems, unsafe workloads, incompatible and failures in risk management systems, cost-cutting and understaffing that would not occur under public management. Another example of this is that Healthscope not being required to implement the New South Wales Health Safe Staffing Level Initiative. Mr Speaker, we saw the scale of community concern at the public forum that was recently held at DYRSL, where over 300 people turned up to hear the Health Minister and the Treasurer and the Shadow Minister for Health, as well as myself and also the member for Wakehurst, and to understand the issues before us with the hospital. Health staff and unions were there also, and what was clear that question after question demanded to know, why can't the government step in? Why hasn't the contract been breached? Why isn't this being treated as a health crisis triggering extraordinary powers? And I note the member for Manly has also questioned this at the time, saying why can't the government step in and get this deal done? The previous New South Wales parliamentary inquiry, and the Auditor General's report have confirmed what locals have long suspected, that a hospital is underperforming, underfunded and mismanaged. As I've mentioned, there are 2 incompatible electronic record systems, critical equipment shortages and lack of clinical integration. This is not good enough, and the member for Wakehurst outlined additional failings that were found in recent submissions, particularly from the doctors at the hospital. The operator has now offered New South Wales Government to buy the public services at the hospital back. A task force has been established, and those negotiations continue. However, as we have heard, those negotiations are at risk of stalling or at risk of having legal or court challenges. That is not in the interest of our community. That is not in the interest of patients at the hospital, staff at the hospital, nurses at the hospital, doctors at the hospital, and is not in the interest of the taxpayer. So what does this bill do? Well, it provides the New South Wales Government with a pathway to terminate the deed without triggering the hundreds of millions of dollars in compensation that would apply under the current contract unless a formal breach has been proven. Given that the PPP was designed to save the taxpayer money, arguably the deed should have also been designed to prevent this if the circumstances in which we now find ourselves occurred. But it hasn't, and it was arguably sloppy drafting. This bill allows the Minister for Health to issue a statutory termination notice, and once that has happened, a default is deemed to have occurred under the deed. This removes the need to prove the breach in court and gives the government leverage to negotiate from a position of authority. The bill sets out the structured, time-limited negotiation process led by the Treasurer. If negotiations do fail, the matter can go to an independent assessor such as IPART to determine compensation based on actual investment, not inflated expectation or projected profits. It also empowers the Minister to issue directions to ensure the continuity of care and an orderly transition, protecting patients and staff alike. There is an argument that legislating to override a contract or a deed creates a sovereign risk, and generally that is true. Government should be cautious when intervening in commercial relationships, but this is not a normal case. It is exceptional, and it deals with acute healthcare. This bill is narrow in scope, it applies only to a specific deed and contains clear safeguards, and it should not be a precedent for other public-private partnerships. Noting that in New South Wales we will not, due to recent legislation, have public-private partnerships for acute public health care services in the future also. I'm satisfied that this is a responsible and necessary course of action, and I'm very happy to hear that the opposition has shown intention to support this bill. This bill gives the state a credible and fair process to regain control of the hospital if negotiations fail, and that is what my community expects. To be clear, my view and my community's view is actually for a growing community like ours, we need more public beds, and ultimately the New South Wales Government should consider purchasing the whole hospital. This bill may go some way to making that outcome slightly more likely. It is a strong step forward to restoring public trust and the trust of our community and healthcare on the Northern Beaches. I commend this bill to the House.
I thank the member. The question is the bill we now